Hey everyone, if you've ever walked out of a doctor's office feeling unheard or like your symptoms were being minimized, this episode is for you. On this episode of AS InfoShare, we're continuing our deep dive with Michael Mallinson. We're going to talk about the patient-doctor dynamic, specifically how to handle clinical dismissal and the tools you'll need to be an educated, confident advocate for your own health. Stay tuned. Information provided in this podcast should not be considered medical advice. We encourage all listeners to consult their healthcare professionals for medical concerns. Thank you. Welcome back to another episode of AS InfoShare. We're back with Michael Mallinson, a dedicated advocate for the axial spondyloarthritis community. In this episode, we're tackling a critical topic: what to do when you feel like medical professionals are dismissing your symptoms, and how you can become a more educated, empowered advocate for your own health. Before we get started, please take a moment to subscribe to our YouTube channel. You can also subscribe to our podcast on listening platforms like Apple Podcasts, Spotify, iHeartRadio, or Amazon Music. Also, please connect with us on social media, including Facebook, X, Instagram, TikTok, and Reddit. And please visit our website, asinfoshare.com, for more content, updates, and product recommendations for those dealing with the condition. If you enjoy the show and want to support us, consider contributing through Buy Me a Coffee. You can find the link within the description or comments, as well as our website, asinfoshare.com. And as always, feel free to leave a comment. We would love to hear from you. Now, let's get into the episode. You do advocate for patients, and I kind of wanted to ask, what advice do you have for patients whose concerns are being dismissed by their primary care physicians? That's a big question I see in a lot of the Facebook groups. What's your advice for those patients?
I think I have three things to say about that. One is advocacy. You have to advocate for yourself, which means that you have to be educated. So that's the second item. And the third aspect that I think comes into that is the use of health trackers. So it's using modern technology to help you manage your disease. In terms of advocacy, I would say that never walk into a rheumatologist appointment or even a GP appointment if it's about your AxSpA and you don't have somebody with you to advocate for you, because they can pick up things and they can ask questions that maybe you overlook. But how can you advocate for yourself? You have to be pretty well educated about the disease. So there's two aspects to this. One is the patient not yet diagnosed, and the other is the patient who's diagnosed but still thinks that doctors are being dismissive of their complaints and things. So I think in the second case, where you really don't have much knowledge because you are not yet diagnosed, you have to go about seeing if anybody can help you with a diagnosis. And online there are lots of symptom checkers. You may not know this, but I have a Facebook page called Axial Spondyloarthritis Resources.
Oh, wow.
And on that page I have links to quite a number of symptom checkers and other things like that. So if you're a patient looking for a diagnosis, that's the place to go to these links that are offered by, say, the National Axial Spondyloarthritis Society in the UK or the Arthritis Research Centre in Canada, and there's ones in the States as well. But go to one of those and see if your symptoms fit in. Join a Facebook group that is for AxSpA or AS patients, as Americans, it seems, commonly use, call it AS still, and see if your symptoms and what you're experiencing matches the journey of anybody else. But don't just walk into a doctor's office unprepared. You have to have a list of questions, and you have to want to make sure you get the answers to those questions so that you're not dismissed. So you have to be well educated to advocate for yourself. Have another advocate with you, somebody that you trust, whether it's a family member or a friend. You need that in the room with you when you're speaking to the doctor. There are lots of resources on my Facebook page, Axial Spondyloarthritis Resources, about how to approach a rheumatology the appointment. So that will give you the sort of questions that you have to ask. Then the last thing is a health tracker. I don't know how many people do this. Some people just use a journal, but there are health trackers that are apps and stuff. When you go to a doctor and the doctor says to you, "How are you today?" you sort of instinctively say, "Well, I'm fine, thank you." And you sort of leave it at that. Then you go on to what's the issue or what's the prescription renewal. Don't do that. Take your journal or your health tracker with you and say, "Well, doctor, thanks for asking. I'm actually feeling okay today. But if you look at my health tracker, 2 weeks ago, I couldn't move. I had a hell of a flare and I was stuck trying to get between the kitchen and the living room. I couldn't move. It was so painful, and make sure you keep that health tracker going. And then you can avoid these episodic instances that you usually talk to your doctor about. "Oh yeah, I'm okay today, but I didn't feel so good a month ago." This way you can say, "Well, look here, I didn't feel so good a month ago, but it's taken me 3 weeks to get over that. Or 6 months ago, I just couldn't move at all. Or I was in such severe pain. Or I had some problems with my bowels," or whatever it is. Make sure you're really well armed with the questions and your health history.
Yeah, the ups and downs of axial spondyloarthritis. What is some of the trackers that you recommend using?
That's a good question, because there was one that was put out by Health Storylines specifically for AS, but I guess it wasn't well used, so they folded that into a sort of a general health tracker. So that's from Health Storylines. I think Apple and Microsoft have their own health trackers, and you can customize them to how you want to put them. Right. So I think as long as you're using one and making sure you complete it and what have you, you're okay.
So what is the biggest misconception newly diagnosed patients have about their future with the condition?
I think the biggest misconception is that it's a life sentence of hurt and pain. I don't believe that at all. I'm going to use myself as an example. I was struck down by this disease in my early 30s, but looking back, I'd had symptoms for quite a while before that. I had a bout of uveitis when I was at university, for example. I went through absolute hell for 10 years before diagnosis. But after diagnosis, I got involved in a patient support group. It was then called the Ontario Spondyloarthritis Association. Membership in a patient support group has shown to have better outcomes than not belonging to a patient support group or organization. I educated myself really well. I went to all the seminars and webinars and stuff that I could find about it. I read books on it, and I'm sure you're familiar with these 2 books. It's actually the same book. One is updated. This is called Ankylosing Spondylitis, The Facts by Oxford University Press. It's written by Dr. Muhammad Asim Khan, who is a professor emeritus from the University of Cleveland. And he updated that a couple of years ago. So it's now called Ankylosing Spondylitis and Axial Spondyloarthritis. But the first edition was available shortly after I had been diagnosed. So I educated myself, which is another thing that the evidence shows you have a better outcome with if you have been well informed, if you are well informed about your disease. So I exercised a lot. I'd always been exercising. The onset of the disease stopped me. I was just running at that time, but I'd be 1 kilometer out and walking, thinking, what's happened to me? As I said, I had 10 terrible years before diagnosis. And that took me to my early 40s. My 40s were all a bit of a blur. I don't really remember my 30s and 40s because of the pain and fatigue. I was bringing up children, etc. I don't really remember it, to be honest. I'm 77 now.
Oh, God bless you.
I row every day on a machine in the winter and on the water during the summer months. I cycle. I walk a lot. Life for me in every single imaginable way is better than when I was in my 30s and 40s.
That's great.
So having axial spondyloarthritis is not some sort of sentence of hurt and pain for life. There is something else that happens that you don't know who it's going to happen to, but it is fairly commonplace that the disease can burn itself out as you get older. I've heard from a lot of people over 50 who say, well, it's sort of gone, And in some ways, it's hard to tell whether that's spontaneous or it's because they've been treating their disease properly with exercise, medication, and eating a healthy, balanced diet. But it does happen. But if you manage your disease properly, and there's all sorts of resources as to how to do that, you should discuss your treatment plan with your doctor and be very clear about what the end stage is. You want remission. And there's a thing in the medical world, treat to target. That's what it's all about, treating to remission and then maintaining remission. Yeah, that treatment plan with your doctor is very important. But to young people who are diagnosed, I'd say it's not a life sentence. You have to manage it, maintain a positive attitude. You have to move the goalposts a little bit. You may not be able to do today, even in your late 20s, what you could do in your early 20s, but be thankful for the things that you can do. Don't worry about the things that you can't do anymore. Just, objectively aim at the things that you can do. So you may not be able to run marathons anymore, but maybe you can do something else. I have a friend who used to be the chairman of the National Axial Spondyloarthritis Society in the UK. He used to be a sprinter at school. And anyway, by the time he was 17, he was afflicted by AxSpA. He went on crutches for a while, and the doctors told him that he had been in a wheelchair before too long. Well, Raj is his name, Raj Mahapatra, is now an ultra trail runner. And he's been doing these long distance races, like, 200-300 miles, which you have to complete in a matter of 5 or 6 days.
God bless.
And, he doesn't have to run fast, but he has to run steady. And as he says, I'm in pain all the time, but at least it's pain that I know and can manage.
It's great. That's amazing.
Yeah.
Wow. How can patients differentiate between reliable medical education and the misinformation often found in online forums? We see that a lot on Facebook message groups. Sometimes people are just throwing out things that might conflict with mainstream medical information, whether it's diets or pills or...
There's a lot of woo science out there, and I kind of perfectly understand it. I don't know if you're familiar with the International Map of Axial Spondyloarthritis. It's a survey. The results are published on the ASIF website at asif.info/IMAS, IMAS. And it's a survey of patients around the world. And the evidence is that between first approaching a healthcare provider with your concerns about your body because you seem to be coming down with AxSpA, until you actually get a diagnosis, you go through this process of bouncing around between pillar and post, going to alternative healthcare providers, and then finally you get back into the mainstream medicine line and you get referred to a rheumatologist. But why do people bounce around? It's because they have a bad experience with their first meeting with a GP about it, especially if they're women. And the GP is not very helpful, maybe dismissive, and you go away and say, well, God, I got this back pain. I'll go to a chiropractor. The chiropractor treats you and you feel no different. So you go to, I don't know what, a massage therapist. It's great, but the relief is only short-lived. So people are going to these alternative medicines, if you like, and they're finding some relief. And I think the important thing is they get listened to. Their doctor doesn't. You got your 10 or 15 minutes and they don't really listen to you. Whereas you go to somebody who's practicing massage therapy or a chiropractor and they actually listen to you and they try and tell you how they're going to cure you or treat you, etc. So I fully understand why people go to alternative medicine. I think it's unfortunate. If I can put in another plug for the National Axial Spondyloarthritis Society in the UK, they have this huge campaign going which is called Act on AxSpA, and it's to reduce the delay to diagnosis down to a year. And in the UK, it's currently like 8 years, and globally it's over 7 years, with women taking 2 years longer than men on average. But anyway, that's a great idea to try and keep people in a process. So they go to their GP, they've got the red flags for AxSpA, and you can see that on the symptom checkers that I've mentioned earlier. And then they should get referred up to a rheumatologist pretty well immediately. And that rheumatologist should see them, within a month or so. That's not happening. So people turn away in frustration and go to these other alternative providers. The other things that is an adverse aspect to really staying in mainstream medicine is the cynicism with which people approach big pharma. They think that they're only in it for the money and that they are not looking for a cure, which is not true. They're only looking for something to reduce the pain or what have you. I don't buy into that theory at all, because I've had a lot of experience dealing with big pharma, and there's a lot of genuine people there who are really, really trying to help patients. And let's face it, modern medicine has saved millions and millions of lives. In my own case, I would have died of pneumonia in the 1950s from a lack of medication if it hadn't been for penicillin. I've had all the vaccinations as well, but that's another story. So I do think that people have this cynicism about big pharma, and they say, we want to do it the natural way. We want to do it the alternative way. And there is no alternative or natural way that any evidence shows has any effect on our disease, period. There's nothing there. There's things that will provide temporary relief, but nothing that's really going to manage your disease except intensive exercise. But it has to be so intensive, I don't think anybody can really do that much.
Yeah. And it's a combination approach a little bit too. Like, it's your medication along with physical therapy and exercise and diet and all that stuff. But the medication is still the foundation of it all.
It is, yeah. The medication is foundation and everything else is lifestyle. You have to change your lifestyle. So reliable medical education, there are lots of places to go. Do not rely on TikTok. Do not rely on Facebook groups. Maybe rely on some things like your podcasts and Yoga for AS and stuff that is pretty reputable and stuff. But if you really want to be properly educated about it, you have to go to the source materials. What are the source materials? Those books that I've mentioned. And also, I mentioned earlier on ACR and EULAR. These are the two biggest rheumatology conferences in the world every year. You can go there to their websites, EULAR, EULAR, and ACR, the American Congress of Rheumatology, and you can see all the presentations from all their conferences, and they're just there for you to pull up if you want to look at them. Links to those are on my Facebook page that I mentioned before, Axial Spondyloarthritis Resources. NASS, the National Axial Spondyloarthritis Society in the UK, has just reminded its members of a wonderful resource. For free, you can go online and see all their past webinars and seminars, etc., 130 of them. And then if you really want to get into deeper things, you go to things like PubMed, NIH, National Institutes of Health, etc., and you look up papers. You just Google, what is axial spondyloarthritis? What is ankylosing spondylitis? How to treat this? There's EULAR ASAS recommendations on the management of the disease, and that pretty well tells you all you need to know. ASAS, by the way, is the Assessment of Spondyloarthritis International Society. It's a group of about 300 global rheumatologists, clinicians, researchers and scientists, and they're the ones who determine the nomenclature for our disease and who advance research into our disease, looking for the cause from which you can find the cure.
And these are all excellent resources. I'm going to make sure I put the links to your page and some of these others in the comments and description of the podcast. Thank you so much.
Perfect, yeah.
That was patient advocate Michael Mallinson. Our deep dive with Michael is just getting started, so make sure to tune in for upcoming episodes. We'll cover the critical role of mental health support, advice for those uneasy about starting biologics, and his take on common dietary myths. We'll also be diving into the specific diagnostic challenges that women in our community face in getting an accurate AxSpA diagnosis and treatment. So please look for these episodes. Thank you for listening. If you found this video helpful, please give it a thumbs up and share it with others. It helps support the channel. Don't forget to subscribe and get notifications for updates and informational videos about axial spondyloarthritis or ankylosing spondylitis. And leave a comment. We would love to hear from you. Thank you.
Like a shooting star, send me on my way. I wanna hear you say, this is a better